On Tuesday, the 28th of October 2025, you're with Coffee Time with Peter Gomez, and this morning joining us is the Minister of Health, Dr. Ahmadu Lamin Samateh. You touched on personnel. What is being done to train, retain, and motivate health workers, especially, nurses and midwives?
Yeah, so of course, so you are aware that we had motivation, accommodation, training prospects, because people want to develop career-wise, and that is opened up. We are now training, we are offering them BSc midwifery. That was not in existence before. They only were doing the higher diploma, and then specialization in pediatric nursing and in perioperative nursing. So those are all motivation, because they now feel well equipped to deal with the people. We are improving on their accommodation. The new health centers that we built in the provinces, the rooms are better than my own bedroom as health minister. So that is good motivation when they get good accommodation. And those rooms are fully furnished, fully air conditioned, Uncle Peter, with flat screen TVs and microwave ovens. That's the new trend. That's what the government is, that's the model. So that the health workers, when they go to work, they're at ease. They work very hard, but when they get back to their accommodation, they have some comfort. And of course, some time ago, there were allowance adjustments. You have seen that the health workers have equally benefited from all the adjustments of allowances of the civil service. And also there were some specific allowance adjustments in the past. So we're motivating them. When it comes to training, we're increasing the numbers. Now, on the side of the Ministry of Health, the CHN school in Mansakonko has been expanded with the support of the MRC Holland Foundation, Madam Henrietta and co. We are very thankful and appreciative of their efforts. That means we can take in more people. Those students used to struggle a whole lot because they needed to get people to stay with in Mansakonko, but now they have accommodation. I'm sure you've seen the new SCN school in Bansang. The MRC Holland Foundation built a completely new, well-equipped school in Bansang for us, so that we can train more people. Because we need to build capacity. That is the way forward for sustainability. We've been getting support from a lot of other countries, but we need to build capacity in country so that our people are taken, better care of.
Something just, crossed my mind. Again, based on my conversation with this breast cancer survivor yesterday, she complained that about 5 to 6 years ago, the country was promised a mammogram machine at the FSTH, which apparently still isn't there. What's the problem?
So we have mammogram machines, except if they're broken down, and we'll have to confirm.
You should know. Are they still working?
Well, those are operational. It's a bit a health minister cannot know about each equipment. It's only in Gambia because of our peculiarity. But in other countries, health ministers don't get to know about what happens in individual hospitals, isn't it? So if it's broken down and they've not fixed it and they've not looked for health, then your friend Dr. Pt.2 has to answer to that.
He's listening.
But I remember the First Lady donated mammography machines, and then we got from other sources. So there was even more than one mammography
Well,
machine.
apparently now there isn't one. That's working.
We will find that, and inshallah, that will be dealt with as a matter of urgency.
How does the ministry ensure, transparency in health projects and implementation?
Yeah.
Because that's one of the biggest problems in this country.
Yes.
You're given $10 to do a job that will cost you $15. People will start saying, he was given $10 and he did not even put it in the project.
Yes. So I think there has been a lot of progress when it comes to transparency and accountability throughout the country. I'm sure we all agree. Once in a while we hear people criticizing here and there, but they know better. They know what we inherited. What we inherited in the health sector has been very, very, very difficult when it comes to accountability and transparency. Those were the days during the old government, the former regime, the former government.
The Yahya Jammeh regime.
Yes, the Yahya Jammeh regime. You'll have officials draw out plans that they are going to do, for example, a workshop in Basse. Have a list, they're going to train 500 people, and maybe only 200 will be real people. And they did the calculations of the extra 300, and those went into private pockets from the reports I got when we started. Those were the days that we had that some people will sit down in Combo and draw a workshop that's supposed to take place in Bantang, and they retire without moving an inch, and they write reports, imaginary reports. When we started, we said, no, we cannot condone that, because for any meaningful development, there has to be accountability and transparency, especially when the resources are meager. They should be put to very good use. So we started restructuring. So what we did, we said, and many of the people can attest to that, that this cannot be business as usual. Then we changed the modality of implementation of those projects. We said if one said is going to train 500 people in the provinces, those 500 people most of the time are health workers. They all have their bank accounts. They have their payroll numbers. So let our PCU get those details of the trainees, and you make direct transfer.
PCU Project Coordinating Unit.
You make direct transfer to their accounts. And that has been working very well. Initially, they made a lot of noise. Every few months they will say, Dr. Samateh this, Dr. Samateh that. They go to the media, they write about me, But we stood our grounds, and then it worked. That has changed the whole strategy. And they said he was closing the doors, but now he has closed the windows. So it created a lot of, but I think eventually they appreciated our stance, that we want to ensure accountability in the health sector and efficiency. And I think partners and the country knows.
It's interesting you raised that, because 2-3 years ago, the nurses were up in arms. Other sectors of other units of the health sector were also up in arms. But you stood your ground. And everybody was saying, no, Dr. Samateh needs to go. He needs to be sacked. Why is the president keeping him there? He's literally angering everybody.
Yeah, so there are forces behind those people. And when you say you want to fight corruption, they don't give up, because they say...
Which was one of the first things you said in Parliament when you appeared.
They think you are their problem. In fact, when some people are broke, they say, this boy is our problem. Before he came, we used to enjoy. Now that he's come, we are no longer enjoying. He has to go. If he doesn't go, and they tell some young ones that, if this man doesn't go, you people you'll never progress in this ministry. And those people now understand. They understand that we stand for them. Because you remember I said when people were to be trained, 500,
yes.
Who are the beneficiaries? These young ones. So they realize that the strategies we put in place is actually for them, so that they get the training that they deserve and they get the pace that they deserve. And I think that has helped a whole lot, because partners, whether we know it or not, sometimes what the partners see and know about us and our countries is much more than what ourselves we know, because they are listening. But that has made them develop a lot of confidence. That is why they are supporting a whole lot of health projects. So we still stand by that, and we're going to continue to stand by that. Sometimes you hear people saying this and that. Some of them don't know. Some know, but for other reasons, they want to mislead the public to have different opinions. And there are some people that you never ever hear them praise the health sector. Come on. Is there no good happening in the health sector? And when those people get sick, where do they go to? When they are involved in accidents, where do they go to? So sometimes when they put unfair criticisms on the health sector, you start wondering, these hard-working health workers who are toiling day and night to provide these life-saving services, when they talk like that all of us, not me, sometimes they say it in political terms, but not me or the president, but these hard-working health workers, running around providing services, how would they feel? And these same people go to those health facilities. If there's an accident here, where will they go to? Even if they think Edward Francis is not good, where else will they go to? So those are the things. So now, that is very important. And there are things that I say to my team each time I have the opportunity. I say we must ensure accountability. That's the starting point. And of course, you heard me talk about why it is so bad for people to be corrupt at any point, at any level in the health sector. And I say that when I have a team, just to ensure that, I say, first of all, Allah doesn't want it. And whatever Allah doesn't want, there's no peace at the end of it. Look at when we were young, those people, they were saying we are corrupt and so on. Where are all those buildings? The children have fought over them. Those who had many wives, the wives are scattered. And then maybe the person is in the next world awaiting for judgment day. Is it worth it? The Lord doesn't want it. That is why when people are doing it, they are hiding. They don't want to be seen. Thirdly, there's no dignity in it. If someone dresses well, he lives well, and he himself, even his wife or children or everybody knows it is ill-gotten money. Where is the pride in it? And they themselves, they don't respect each other. If they are involved in a deal, will they respect each other?
No.
No. And finally, I say to my team, just so that our consciences are pricked, anyone who uses corruption money to pay school fees, the children might not pass exams. So, Peter, we are very strong on those, and we think is the way forward. And I'm happy that Ministry of Health, we're doing quite a lot on that, and government itself is very, very serious, in dealing with corruption.
Of course, we have this high-profile health, corruption case in the courts. We can't comment on the case, but it involves one or two people who are very close to you, your advisors. Even when their issue came up, were you surprised that could happen, even with somebody that close to you?
So some of these things are very difficult. The one in the court, it didn't happen my time. I met that, and yes, it was very surprising, indeed, and very difficult. Because we cannot talk much about it.
Yeah, sure.
I don't know the veracity of the facts, the veracity of the case, but it came as a big surprise. And of course, you would have been hearing about other situations here and there, which are all being investigated, and some of them the investigation has concluded, and then they are waiting for opinions here and there. But the more recent one I'm talking about,
yes.
They are all very devastating for me, because when you work hard, you try to live by example, and you do your best, and you struggle. And once in a while you hear things like that. They are very, very devastating. But nonetheless, we also have a lot of challenges in the system. There are people who also work with us, but they are not with us.
And what mechanisms are in place for citizens to report concerns or provide feedback on health services?
So thank you very much. And I think that's a very important area. We have a unit, a communication unit, and we have the 1025 number, which is still working. So people should call if they have, and typically what they do is they document, these calls, and those who want assistance, immediately they refer them to the sites where they could get those kinds of support. But those that want to report, they also document and let it, get to us. So 1025 is active. It's located in Kotu here.
Mm-hmm. Okay, I'll do a few questions for you now from the public. Good morning, Peter. Can the minister estimate how many people in the Gambia are suffering from severe mental health disorder, as well as those who are suffering from moderate to mild mental disorder? Secondly, in the Gambia, there is only one mental health facility, Tanka Tanka. How many psychiatrists do you have in the country? What is the psychiatrist-patient ratio? And this is coming from Mam Said.
Yes, so typically, from the information I gathered from my people, they said up to 8% of people have some form of mental health challenge.
Which would be how many? Well, hundreds of thousands of people.
Yes. So that will be quite a big number of people with mental health challenges. Unfortunately, the mild one I am not able to tell you, but we can provide information for you. Subsequently, our mental health unit will be able to provide that. Now, we have Tanka being the only psychiatric hospital, that's quite true. We intend to improve on the quality of services there. But now we have a professor of psychiatry who is there. We brought him in so that he's able to train people. And then we have some young doctors also posted there. And we have a resident doctor, I think, who has come back to town, who has, I was told, passed his membership exam. And at some point we have 2 Cuban psychiatrists. Other times we have up to 3 to 4 psychiatrists. So all in all, we would have 6 to 7 psychiatrists in the country. Okay. Of course, the other challenge is the psychiatric nurses. So what we intend to do, and we are in touch with partners in Egypt to help us build psychiatric capacity in the Gambia. Yeah.
Good morning, Peter. Can you ask the Honorable Minister, why are they still keeping dead bodies in the container outside the mortuary? The ice room, which was built by Gamtel or managed by Gamtel, has been out of service now for more than 2 years and nothing has been done about it.
Well, that's information for me, so I will find out. And if they don't have genuine reasons, then the issues will be dealt with, inshallah.
Okay. What about the container,
Even the container, because I thought that was a surge capacity during the COVID time. So I'm surprised that it's still being used.
Okay. Good morning, Peter. You're welcome by saying improvement in the health fertility may be. You don't used to go to government hospitals. The services at hospitals are now worse than ever. Example, visit Fajikuna Health Center. Even paracetamol you will not get. RVTH, you buy everything when you're admitted there. No medicine available for patients admitted. I may be wrong if I say there are no medicines there, but for the patients who are admitted, there is no medication for them. And this is from Bubakar Sano in Fajikunda.
Yeah.
So the Fajikunda Health Center.
So the health sector cannot be said to be worse than before. That's unfair, and they know it. Even Bubakar knows it.
You deny that categorically?
I deny that, but I mean, it's there for everyone to see. The medication challenges are there, but some medications are available. So I think people should stop saying there's no medication. They might not have all the medicines that they are there. I think typically the point is, Peter, Gambians are used to something that sometimes is difficult to sustain. That is free medication throughout. It happens in no country, even in the West, because they pay heavily for health insurance.
So why did people believe that under the Jammeh regime,
yes,
people got medication for free?
During the Jammeh regime, they couldn't talk about it. I was in the hospital. They were afraid to talk about it. We were supporting the patients to buy plaster. We were supporting the patients to buy paracetamol. We were supporting the patients to buy catheters. There were times that we did not have appropriate sutures. I was in theater. There were times that we didn't have monitors. We operated the patients almost blindly. We didn't have suction machines. There was a time there was only a single functional suction machine for the entire Edward Francis Small Teaching Hospital.
Oh, wow.
That was in the theater, and the nurse in 6 and 7 ward would run to borrow it because there's a patient vomiting who might aspirate and die, because nobody could talk about it. That was the only thing. It was much worse because I was there. So they cannot pretend. So most of that is political, what they are saying. Yes.
Good morning, Uncle Peter. Can you please ask your guest what is next on the EFSTH audit report and what mechanisms are put in place to prevent recurrence of such corrupt practices?
So I guess he has heard my strong stance against corruption. It is disheartening. Disheartening in the sense that these things could even be perceived. Talk less of even happen. So when we hear this, I was the CMD of the EFSTH. I did my best to bring about accountability, to bring about sanity. It was difficult because those are the days that they will pour spiritual water on my car.
Oh.
Yes. I'll come and meet the whole of my car wet because there are people who were against that. We thought it had stabilized. We moved, and then some of the bad practices crept in. Now, but I think, so the audit report is still being investigated. Government the police are looking at it, and they are looking at it diligently. And then, but we have changed the management there, and Dr. Pt.2 and team, I believe, will do a good job.
Hi, Uncle Peter. Please tell Minister Samateh to be paying surprise visits to health facilities. He will be surprised. Have you paid any surprise visits?
Oh, I do that.
What's been your finding so far?
Yes, sometimes not too happy. I tell you what I did a few months ago, about 2-3 months ago, in Brikama Health Center. I parked my car on the main road and I walked alone. And I went and I stood whilst they were taking care of patients before some of them recognized me. I was not happy because I met the room not clean. I didn't meet a bed sheet on 1 or 2 of the beds, and there are bed sheets, clean bed sheets in the hospital. The walls were dirty, and a previous visit, I stood there and I said to them to bring out the cloths and the cleaning materials. So we cleaned it all together. I said, but that is not for a minister to do. The hospital has a head. The region has a regional director. It has regional people who are responsible for to ensure that. But I did it to teach them that this will not continue, and we will act on it if it continues. So we pay surprise visits to health facilities, and we'll continue to do that. But I think, Uncle Peter, what is important is for people in this country to do what they are paid for. You see, if the minister does his work, the permanent secretary does, the directors do, the heads of the hospitals do, the heads of the wards do, the cleaners on the wards do, the drivers do, everybody does, Gambia would be a very beautiful country.
Absolutely.
But I think this is the problem.
Absolutely. Without
So
a doubt.
now, when others do not do their work and they keep on blaming the head of the institution and the head of the ministry or the head of the entity, that's the problem. But I think how we can deal with that, and the health sector is working on that, and the government is actually working on that, is to have performance indicators and management systems that will put checks and balances. If someone is supposed to do something and their appraisal, robust appraisals, unbiased appraisals, without looking into the eyes of anyone, then we will get there. And I'm happy that government is spearheading that in the public administration modernization program. And Ministry of Health, World Bank is helping us also in developing a performance management system so that people are brought to book.
Good morning, Uncle Peter. I want to use the opportunity of the minister's presence to ask about the bread. It's like what was agreed on improving bread and hygiene is not respected by bakers. Yeah. I just bought a bread, tapalapa. The flour is expired. I see insects and strange things inside the bread. I can even feel something in my stomach. And also the size of bread is back to this is so funny. Yeah. It's back to where it was. I am in the North Bank, Bakindik village, and the sender is Sekou Omar Khan.
Yeah, thank you very much.
Do you work with the FSQA?
So our teams work with the FSQA, but I'm happy you mentioned the FSQA.
Yes.
Omar, bread and food control is under the FSQA. Yeah. And FSQA
Food
is
Safety and Quality Authority.
And is not under the Ministry of Health. But we have a stake because anything that will be detrimental to the health of the people, we are concerned. And we do work with them. So fortunately, our new food and drug lab will be completed very soon, and food quality will be tested in this country. The oils we eat, the flour we eat, and a host of other things will be checked in this country. So I myself am very, very happy that Gambia is going to be able to test this, and that doesn't happen in many of the countries in the sub-region. So we'll be able to deal with that. But that said and done, we will also mention to the FSQA, Uncle Peter, we're trying to put in strategies to deal with the gaps in areas that affect the health of people. One area is we now recently set up, we identified someone who is working on drowning prevention and control. There was no unit for that in this country, in the ministry. Patient safety. There's no unit particularly directed to that. So there we have focal points. Telemedicine. And recently, some time ago, I called my people, and each time I go around, especially these sewage tank trucks, they drive on the highways, and the sewage is leaking. So I myself go and then I caution them. Sometimes they think this man is very troublesome. I go and tell the public health officers, go after this person, they go after them, and they did sensitization and so on. So that itself is a health hazard, and it needs to be regulated. But it doesn't stop at that. So now we are also, I tasked my team to also look at the hygiene in the salons and the barbing salons, and then the other one that the women go to, you know, so that the hygiene, those items that are used, what guidelines are there in place? So actually, in part of our health system strengthening, we are also looking at the laws. So as I speak to you, we are working on up to 10 draft bills. Some are new, some are reviewing the old ones that we've seen have gaps. But one of the things we are also looking at is to have Allied Health Services Regulatory Authority that's going to look at the practice of laboratories in this country. There's nobody responsible for lab safety in this country. We didn't inherit it, so we are put in that place. Also, private clinics. There's nobody responsible for the regulation of what they do. We didn't inherit any, so we are developing a health facility regulatory authority that's going to regulate both private and public health facilities to ensure that they abide by the rules.
Good morning, Uncle Peter and Honorable Minister Samateh. I sincerely thank him for being with us at this important program. One of my PWD members, persons with disability, who is amputated and spent $18,000 on medicines within 3 weeks to a month. Please ask him what support they can give to people, especially persons with disabilities, those who beg in the streets in particular. This is coming from the Chairman and Secretary General of the National Organization for Disabled and Orphans, Mr. Lamin Mani.
Yeah, thank you very much. And we are very concerned as a ministry, and I think government itself is very concerned, to support the people who have challenges in this country. At the level of the health facilities, typically for services that are paid for and they are unable to pay, they just need a request and a waiver will be given to them in the facilities. The chief medical director, if it is Edward Francis Small Teaching Hospital, is able to give them a waiver for such situations. But the directorate or the Ministry of Gender, Women and Social Welfare has provisions actually to support people who have challenges. And to the best of my knowledge, they've been supporting some of them.
Fantastic. I don't intend to keep you beyond 10 o'clock here today, Dr. Samateh. I'll make this the last one. It's from CDQ Suno from Faraba Banta, a regular contributor. My question, he says, for Mr. Samateh is, what are they doing to fight rampant corruption in the EFSTH and to fully equip our major hospitals? Just recently in Brikama, a woman was told to buy a glove before they could treat her in the delivery department.
So you see, Peter, there are gloves in Brikama Health Center. They are there. After that incident, I was very furious. I called the head of the hospital and the director for health services. I saw video circulating. So I think, first of all, the rampant corruption, what he calls rampant corruption, because I don't think there's rampant corruption. You see, if there's rampant corruption in the Ministry of Health or this country, we wouldn't have been able to do the development that we are doing now. We are doing more development now than the former regime. A lot more. Of course, every Gambian knows that there was a lot more corruption before than now. It is because then nobody could talk about it. But now government has opened up the doors. Government, you see, if the auditors are part of government. Government has made work easy for them to look into the accounts of government and guide government in dealing with corruption. I think government should be applauded for that. That's a positive step. Making work easy for the auditors. Auditors were here in this country during the former regime, where we seen audit reports here and there, because the room was not there for them to do their work. So I think government should be accredited for even exposing these things. So I don't think it's rampant. It's not rampant. But as we go towards the election, you are going to see a lot of these fake videos and then some of these. Oh yes, yes. It's a strategy.
This claim could be fake.
Oh yes, so it's an election strategy. Sometimes they get videos from outside. Of course, there are people in our hospitals who are anti-government. Before the last elections, we had some of them. People go to them. They will say, "Go, you people. There's nothing here," so that people get upset with government. It's a strategy. And this government is doing much better than many of them can ever do, really. So yes, gloves in Brikama Health Center. In fact, they sent me the pictures of those. But I think typically when people get this kind of, because whoever would have told that person, go and buy gloves, might himself or herself be doing it to annoy the patient and, to arouse sentiments. And that has happened. He succeeded in doing that. So we expect to see those. But what I urge him to do and other people to do is, if anyone tells them what is out of line, let them report and mention the person's name. And let them be ready to serve as a witness, because we will deal with the issue very seriously.
Fantastic. Dr. Samateh, again, thank you so very much for coming. Just finally, what message might you have for your audience, those listening, those who will be watching later?
Yeah, thank you very much. I think, Uncle Peter, thank you for giving me the opportunity. This is remarkable. I think the people that we work for need to hear from us. But I think it's important to say this is our country. We need to build it together. Whether people support government or they don't support government, we should support government. Whether we are part of government or not, we should support government, develop this country. And where government does well, and we are doing well in many areas, we should be applauded. There are some set of people, I've never heard them say government has done well. Is the government not doing anything good? We are doing a whole lot of good. And we certainly will, inshallah, continue to do well. And because they cannot do close to what we are doing if they had the opportunity. Some who had the opportunity before, they didn't do anything. And I'm a living witness to that. In fact, they caused blunders. That will be for another interview.
Dr. Samateh, thank you very much for your time this morning. Dr. Ahmadu Lamin Samateh, the Gambia's Minister of Health. And it's Coffee Time with Peter Gomez, live on West Coast Radio on FM 92.1, online www.wcr.gm.
Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Excellent jam, Wave. Yo, apply. Yo, luta do dede. Luta mo nulo jël moto nga andil ma xaalis. Hello? Bisul mu fay.
What?
Bisul mu fine.
Oh, yes!
Wave acts in Gambia. Deposit and withdraw money, pay bills, and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave, Bisul mu fine. Wave, your money is yours.